There's a lot of talk between corporate and private practice in dentistry, and if you're a patient, you probably don't even know the difference. This video is basically going to be my rant about corporate dentistry. I used to work at a corporate dental office, and even though I was making a decent salary, I quit after just 6 months. And I'll tell you why. Hey guys, my name is Amanpreet Singh and I'm the founder of Dental Secrets. Before I get started with the video, make sure you hit the thumbs up button and subscribe to my channel below. Let's get into it. The culture is so important when you go into a dental office, and I would even argue that it's the most important thing for both the provider and the patient. The private office that I work at now is very patient focused. The goal is to really make it feel like a family when the patient walks in through the door. I have never seen a corporate office whose main focus is on patient care. In most private offices, the dentist will spend more time with each patient, they'll talk with them more, and they'll really get to know them. But in corporate dentistry, the culture and the focus is pretty different. In corporate, it's really all about the procedures that you're doing. So a lot of the times, you don't even know who the patient is. You just walk into the room, start doing treatment, and then you leave. And the patients aren't really fazed by this difference in culture. They're actually pretty used to it. They're used to seeing different doctors every time they get treatment, and they're used to having not as pleasant of an experience. And part of the reason is a lot of these patients don't know that there's better options out there. Most people, when they're looking for a new dentist, just search Google and find the nearest dentist to them, and they don't really care if they're a corporate or private practice, or they don't even understand the difference. But sometimes patients do understand the difference, they just know that corporate's the only place that accepts their insurance. What that means is they'll be paid relatively low for each procedure that they're doing, but they try to make up for it for the volume of patients that they're seeing. Well, that's great in theory. Doing that much volume can really hurt the providers that are trying to do good treatment, and that also hurts the patients who are expecting good treatment. Most corporate dental offices are owned by larger companies that are not dentists. I got affected quite a few times by some of these insurance plans when I was working in corporate. For example, some of these patients had DMO insurance plans. The way most of these plans work is the company will take an upfront amount of money from the patient's insurance for the whole year. And all those patients' treatments that they need for the whole year are either really cheap or they're free. So if I was in a corporate office and I was paid on production and I did treatment on one of these patients, I would get no reimbursement for the work I did. And this happened to me multiple times. For example, I had to do a root canal on one of my patients, and both the patient and the insurance didn't have to pay any money because they already paid upfront for the whole year. So the corporate company already got their money for the year beforehand, and the patient and their insurance already paid beforehand, but the dentist, aka me, never saw any of that money. But this actually isn't one of the reasons that I quit, because one, I was a new grad and I was trying to get as much experience as I could, and two, I felt like I was actually helping these patients who no one else would see. But if you have a good insurance, I don't see why you would go to a corporate office over a private practice. Yeah, some private practices aren't that great. I'm not saying that every private practice is better than a corporate office, but in general, the quality of dentistry that you get at a corporate office is just not the same as you would get at a private office. And that doesn't mean that the doctors themselves are bad at these corporate offices. Some of them are actually really skilled. But again, it's the culture. Most corporate offices are owned by larger companies, and these companies are not dentists. And I don't think that's the reason that some of these companies aren't run well. I really think any company can run well as long as you get the right people in the right place. But from what I've seen, most of these corporate owners have no clue what's going on in each of their practices. Either that or they just don't care. And this is what I feel like really drives the culture downhill at these corporate offices, including the one that I worked at. And this is also the main reason that I quit after just 6 months. When I worked at my corporate office, I would run into a lot of issues with both one of my assistants and my manager. For example, we were seeing this one patient who really wanted these 2 aesthetic crowns on her front teeth. I did a consult with her, I went over her options, and she was really interested in the treatment. The only problem was we didn't have the right materials in our office to do the procedure. So I went to my manager and I asked her to order a couple things for the office, and before I even started working there, they told me I was allowed to order whatever I needed to do the treatments I wanted. But when I went to my manager to ask her to order a couple things to do this procedure correctly, she threw a fit and she started complaining that I'm too expensive. And keep in mind, these were not crazy, super expensive materials. These were really basic items needed for the procedure that we were doing. I think all it was a type of cement and some primer solution needed for the crowns that we were doing. And I'm not an unreasonable guy. I don't order things I don't need. Dang, that's a nice Gucci belt. I might cop one of those. And it wasn't with just that one procedure. This is an argument we got into with almost everything I wanted to order. Do you want me to do the procedure or not? It got to the point where I didn't even want to do some procedures repairs because I knew we didn't have the right materials. And it wasn't just my manager. Other people in this corporate office like to cause problems too. Sometimes I would already be in the middle of a procedure, and my assistant would refuse to bring me something that I asked for. This is a true scenario. I was in the middle of extracting a tooth when I asked my assistant to grab me a handpiece to section the tooth. Basically, sectioning the tooth is when you split the tooth in half before taking it out. This prevents you from putting as much pressure on the bone, and it can help prevent breaking any of the bone that surrounds the tooth, and this is very useful if the patient is interested in getting an implant. But when I asked my assistant to go grab me a handpiece, all she said was, "No, I don't think you need that, doc." I'm sorry, who's the doctor again? So I would have to deglove, go out of the room, and grab the handpiece myself because my assistant refused to grab it for me. I don't like causing scenes, especially in front of a patient, and I hate drama in general. I just wanted the end result for the patient to be good. But this all goes along with the culture at these corporate offices. When they hire people, they don't care about the culture or the values that they believe in. All they care about is if they can show up and do work. And another problem at these corporate offices and why most people quit is that they really push unnecessary treatment. Now, some corporate offices aren't as bad as others, but some are just terrible with this. Some corporate places I applied to right out of school would have the doctor working 3 full columns. That means that the dentist would have to see 3 columns of patients at the same time. And these weren't just quick appointments like a consult or a hygiene exam. These were all procedures that the dentist actually had to be there for a good amount of time. Imagine a dentist doing a cleaning, a root canal, and an extraction all at the same time. It is really rare that that dentist is going to do a good job. And that truly sucks for all the patients that have to go through that, because not only do they have to wait for an extended period of time, the quality of work they're receiving is not that good. And the worst part about this is some of the treatment that they're pushing is really unnecessary. I had some experiences of this in my office, but luckily it wasn't as bad as what I heard happens in other corporate offices. Some of my friends that have worked in corporate offices have really been pushed to do unnecessary treatment on their patients. For example, they would see a patient who's been treatment planned by another doctor to do some fillings. The only problem is when they go to see what fillings are planned, they don't think any of those teeth actually need a filling. So now they're forced to have a really awkward conversation with the patient and explain to them that they don't think that they need the filling, even though another doctor already planned these fillings, and they hear complaints from the management higher up that they should not be changing other doctors' treatment plans. And obviously that's absurd. If you're a dentist, you should only do what treatment you think is necessary. You don't just blindly do treatment because someone else said so. I did see a lot of that too, and I had to change a lot of the treatment plans at my corporate office that I used to work at, but luckily I didn't have too much backlash whenever I changed the treatment plan. Again, the main reason I quit was because I just hated the culture there. I really wanted a culture that was patient-focused and everyone was on the same page. But that's really difficult to get in a corporate office. So if you're a patient and you're watching this and you're really happy with your dentist, I'm not telling you to change anything. But if you are looking for someone new, I did make a video on how to choose the right dentist, and I put the link to that in the description below. And if you're a new grad or a dental student that's watching this, I wouldn't totally write off working for corporate. Corporate dentistry is good for some people, and it's great for right after you graduate because you can get some experience and make some decent money doing it. Thank you guys for watching. I hope you liked that video. If there's anything else you wanted me to talk about or any questions you had, please let me know in the comment section below. And before you get going, please hit the thumbs up button and subscribe to my channel below. I'll see you in the next video.